these two projects we are coordinating are quite different. One is within the Horizon Europe framework, which is giving us the opportunity to mainly interact with academic colleagues, but also with small industry partners. It's called SQUEEZE. It's all sort of halfway of its 5-year running period, and it is about optimizing treatments for rheumatoid arthritis. So it is really a project that for once is not about innovation, but about using what's already there on the market, available in clinical practice, and how we can maximize the impact of all these therapeutic regimens we have for patients with rheumatoid arthritis. The other one, AutoPiX, has just started half a year ago. It's an innovative health initiative project, so a larger project that involves also the big players in pharma in Europe that also give a lot of money from their side on top of the European funding. And it's really working together on huge imaging data sets where we want to take artificial intelligence for imaging in rheumatology to the next level. Well, they both are not only engaging with patients. For both of these projects, patient participation and contribution is key and essential. Not only now that it's running, but it really already was from the beginning of writing the protocol, where it is important to us. And of course, it is also important to the European Commission to have the patient view integrated into scientific activities that we do, or if you take the head of the European Commission, of activities that are funded. Well, I guess we wouldn't refuse any patient who would come to us, but in theory, you get to patients who are interested through patient organizations. And for the two projects that we are leading, it is EULAR as the European umbrella organization in rheumatology, and EULAR with this patient organization PARE has a strong network of patient research partners that all of whom receive a special training to become these PRPs, and together with EULAR we can identify the best and most interested patients, of course, as well for each of these projects. And that's how we did it. But there's, of course, a lot of other patient organizations in other fields, and there is, of course, national patient organizations. Usually the English language skills are the limiting barrier for some countries, patients from some countries, but otherwise there is the more the merrier. These two projects, I told you about AutoPiX, it's just started, so we will have a booth at the conference, which we hope will be nicely populated. And we also have a booth for the SQUEEZE project, the project on maximizing drug impact in rheumatoid arthritis. As I mentioned before, it's in its third year, and therefore there's already a lot of output on top of having the booth. There's a lot of abstracts have been submitted, and we're very proud that at this EULAR conference there's 8 abstract presentations as posters, and 4 abstract presentations as orals in the Congress. So very great success for SQUEEZE, which makes me personally also very happy.